Hello, I'm Dr. Harris Friedman, and I'm a psychologist trained in clinical and organizational psychology. And in addition, I'm a research professor at the University of Florida, retired, as well as I'm affiliated with a number of other universities. And in the past, I've worked as a coordinator of a human services program and as a chair of a large clinical psychology doctoral program and as an academic dean of a university, in addition to being a professor. And I work a lot with a field called transpersonal psychology that most people consider to be spiritual psychology, although I take it from a slightly different vantage. And in that work, I do a lot of research and have supervised a lot of research students. As a clinical psychologist, I've also included in my practice a lot of work with people who are taking psychedelic medicines in terms of the integrative therapies and preparing people for and helping people integrate after psychedelic experiences. And I've worked with a number of other types of psychotherapies. I've also worked a lot with organizations and actually have consulted in over 30 countries in different organizations. And I've built many systems of care in the human services, medical, as well as psychological fields. I've been doing this type of work for many years. In fact, as an undergraduate psychology student back in the 60s, I was involved with a peer help group that I helped support. A lot of students back there were involved with psychedelic exploration, and some of them got into trouble. But when they sought mainstream help, they were often treated inappropriately. For example, I'm thinking of one woman who was a friend of mine who had a bad psychedelic experience and ended up receiving electric shocks and all sorts of what I consider to be brutal treatment. And what we tried to do is when I was an undergraduate, me and some of my colleagues, or at that time friends, was to identify such people before the establishment got a hold of them. So I've been interested in this for many years. There are many definitions of transpersonal psychology, and people in the field can't seem to agree on one definition. I recently edited a book called the Wiley-Blackwell Handbook of Transpersonal Psychology that has like 50 chapters in it or so. And what I did is I got the major figures who identify as being people in transpersonal psychology to write chapters. And so there are 50 different versions of transpersonal psychology or more based on each person's contribution to the book. But I can talk about my approach to transpersonal psychology, but not everybody agrees with me. And some people even, don't like what I do who are in the field of transpersonal psychology. But I see transpersonal psychology as a field of psychology, and I see psychology as a science, an empirical approach to studying aspects of human beingness, and that just like we have a physical experience, we're embodied, and we are social. We also have aspects to ourselves that go beyond the individual level. One famous psychiatrist, Carl Jung, talked about this in terms of things like a collective unconscious, where deep inside, all of us share similar collective memories and collective behavior patterns, and that these things are not personal, but they go beyond, which is what the prefix trans means. They go beyond the personal. So experiences that are deep and high and broad and universal can be seen as transpersonal. And one example would be mystical experiences where a person recognizes their profound interconnectedness with the world and they go beyond seeing themselves just as an isolated individual, but as something more deep, more profound, that is interconnected, and possibly even in the realm of spirituality and religion. But transpersonal can be secular, or it can be understood in religious or spiritual terms. So I'm interested in things like uh, uh, transcendence, peak experiences that go beyond just being an isolated individual, experiences of interconnectedness with the environment, with other species, with humanity as a whole. Um, Many different ways that what we are is part of something much larger than ourselves, and in that way is transpersonal. Well, there are a number of models as to why ketamine might be an effective medication. And one of them is the phenomenological model. That is how it affects people's lived experience or inner worlds. And included in that phenomenological aspect would be spiritual experiences or mystical experiences. And there's a lot of debate in the ketamine area as to whether the effects of ketamine are based on conventional psychophysiology, and that the phenomenological experiences are just kind of add-ons and maybe hallucinations and delusions, or whether these phenomenological experiences are important or maybe even crucial for the changes that people might see after taking ketamine as a medication. So, from my own perspective, I tend to believe that the physiological things are real; they happen. In terms of things like greater brain plasticity, such as growth of neuronal dendrites and axons. Also, I tend to believe that the phenomenology is very important, and if people can have great breakthroughs in their understanding and their worldview, that makes a major difference. And I'm thinking of a story that I was told by Eugene Evgeny Krupitsky, a Russian researcher on ketamine who's probably done more ketamine studies than anybody else. And he was talking about working with a chronic alcoholic in Russia with ketamine therapy. And this Russian person was drinking, very large amounts of vodka, and was very deep end alcoholic. And he had a ketamine experience, and Krupitsky was telling me that when he came back, he said, I had an out-of-body experience, and I went to the afterlife, and I met my grandmother, and my grandmother chastised me for throwing my life away and just choosing the bottle over a healthy life. And I swore to my grandmother that I would change, and then I came back, and he never drank again. And so whether that be real or whether that be a figment of his imagination facilitated by the ketamine, I don't know. But for him, that apparently seemed to work. It's an artificially constructed, man-made substance, and there is a lot of prejudice against ketamine. There are many people who have romantic beliefs about things like back to nature, and they prefer to take a medication that maybe is plant-derived as opposed to made in a laboratory. But since the discovery or invention of ketamine, however you might want to see it, whether it was discovered and was out there in other forms or whether it was invented by humans, Uh, it has had great success. For example, in Vietnam War, when America was engaged in that country, ketamine was the most widely used anesthetic in the field, and soldiers used to carry, vials of ketamine. And if somebody got injured, they would administer the ketamine via a syringe. So it was actually called the buddy drug at that time because your buddy would shoot you up if you got injured. Uh, and the fact that ketamine is found to be neuroprotective in pediatric surgeries, and that uh, uh, so it's had a long and varied history. And right now, there's a tremendous amount of research on it, thousands of articles, literally, and during the suppression of psychedelic research, most of the research was on rat models and using other animal models to study ketamine. So even though it was underground and used a lot in raves and in other informal and illegal ways by people for recreational purposes, there was a long history of looking at it through animal model studies. Uh, and today there's a real resurgence. There's lots of studies on ketamine today that are ongoing. And I know I'm supervising a doctoral student right now in India who is using ketamine for in an oncological setting, looking at how it helps people who are facing terminal illnesses to adjust and to have a higher quality of life. And what I'm particularly interested in with that research is that in the West, we tend to see life as the end of existence, whereas in India, for many people, particularly those who follow the Hindu and some related traditions, the belief in reincarnation is so strong. So there are different worldviews and dynamics in terms of facing death in that culture as a generalization compared to in this culture. So replicating some of the findings of the ketamine studies in the West in a different cultural context in India is something I'm really looking forward to seeing the results of. This goes to set and setting. And I think set and setting are so crucial. So set is the mental stance we take toward and experience our own position in life, how we view something. And the setting would be more the physical surroundings or social surroundings. So internal versus external. And regarding the set, I think a lot of people might have trepidation or fear of a psychedelic experience. We're oftentimes very controlling, and we want to feel safe and in control, despite the fact that all of us are being tossed around by so many different circumstances, and we can do what we can, but nobody has complete control. And sometimes trying to be too controlling can be counterproductive. That the harder we grasp for water, the more it flows through our fingers, as the spiritual saying goes. So for people who are wanting the benefits of psychedelic medicine, but maybe really too anxious or fearful about how it could disrupt their world or be scary, maybe a more calming meditation might be useful. So, for example, prior to engaging in psychedelic experiences, maybe to do some sitting zazen or vipassana or one of the other forms of mindfulness, maybe even Benson's westernized version of mantra meditation, where instead of using a mantra that's supposedly has mystical powers like in transcendental meditation, just meditating on the sound of one's own name or the sound of the word one to a certain point where a certain peacefulness and relaxation can occur. Benson called this the relaxation response. Benson being a well-known psychiatrist from Harvard who did a lot of research on meditation, maybe in the 70s or 80s. So with that said, depending on the person, and this is a generalization that I'll make, which is I really think these experiences need to be as customized as possible. It's not one size fits all. Everybody comes to the experience with their own history and their own proclivities, and how to work with that person to come up with something that might optimize the outcome. And one of the things I like to do in, say, a preparatory session with somebody prior to having them experience is to set some sort of intentionality to clarify with the patient what they want from the experience, and to see if there's some way to increase the odds that that experience can meet that person's needs. So if the person has a lot of anxiety about, say, a ketamine experience, I might want to work with them a little bit on anxiety. And it may not be just one session. It may be, 6 months of work if a person's presenting a lot of anxiety before they feel safe enough to jump into an experience where they're tossed around in the whirlpool and they don't have control, but yet the doors are open to greater change and to possibilities. And that I would always encourage a person to weigh whether that risk is worth it. And if the person's in a good place and they don't feel like rolling the dice and having something that could change everything in their life, maybe that's not the experience they should seek, or maybe they should seek it at a very small level so that some of the benefits can be had, the, say, antidepressant, anti-anxiety benefits, without really having the brain rewire itself and to have an extremely potent experience. So this is something to do with the set and how the set can be modified in some ways by giving people a prior experience, such as maybe some treatment for anxiety, or maybe some calming meditation. And then likewise, at the end of the experience, maybe post the medication, maybe that's a time when another type of meditation might be useful. Maybe at that point, if we're looking at doing an action plan, how can a person take whatever insights they might have obtained and put it into action to make beneficial and sustainable changes in their life? Then maybe a more arousing meditation that activates the person so that they can make real what they've discovered or explored. So that's a little bit about set. Regarding setting, I could say a lot, but one thing I'll just say as a generalization is some settings can be very encouraging and some settings can be very off-putting, and to try to come up with a setting that is appropriate for the individual. And I'm thinking of one area where I have some concerns. There are a lot of use of music while people are taking psychedelic medications. And I think it's very, very important, if music is used, to customize the playlist and not put everybody through a boilerplate group of music that may or may not be appropriate for them. So certain music might be very emotionally evocative if that's the goal. Other music might be very calming if that's the goal. But how to design the setting to be appropriate for the individual. And these are questions that people are researching. There's a lot of studies right now, and some recently came out on the appropriate use of music during settings. And there's so much we don't know. But I have a faith that if we attune ourselves to the individual patient, we can do better than chance in designing the settings that would be most useful, as well as working with people to come up with healthy sets that could make the experience worthwhile and beneficial.